Hello, we are here for the Check-In Project and our first live expert chat with Anna Gai, who is going to be talking about it's okay to not be okay, even during the holidays. So Anna is graduated from the University of Virginia in 2015 with her BA in psychology. In 2016, she entered the clinical psychology PhD program at Florida State University under the advisement of Dr. Thomas Joyner, earning her Master's of Science in 2017 and is currently a doctoral candidate with the program. Her research is focused on suicide-related thoughts and behaviors, particularly among special populations, such as the construction and extraction of the industry workforce, first responders, military servicemen and women, and veterans. Anna has clinical experience with the FSU Psychology Clinic, providing outpatient clinical services for Tallahassee and the surrounding community. She has experience with treating veterans at the local VA behavioral health clinic and is a neuropsychological assessment with the Tallahassee Memorial Hospital neuropsychology department. Anna served a year as the assistant director of the FSU Psychology Clinic. She has volunteered with Given Hour since 2014 as a student liaison and is a current board member for the STEM Veterans USA, a nonprofit collecting military veterans and technical skills in the STEM fields with opportunity. Currently, Anna is the director of the Statewide Office for Suicide Prevention with the Department of Children and Families Office of Substance Abuse and Mental Health. And without further ado, here is Anna.
Good afternoon, and thank you so much, Sky, and everyone at the Check-In Project for having me today. I am so excited to talk with you all about suicide prevention. So this topic is highly relevant year-round, and a lot of the things that we'll talk about are applicable throughout the year, and potentially even more so as we're gearing up for the holiday season. So I really love the holiday season. It's a wonderful time filled with a lot of cheer, but also at the same time, it typically brings a lot of stress and anxiety as well. So to give us a little roadmap for today, I'm first going to give a little more information about who I am and of the suicide prevention infrastructure within Florida in general. I'll give a brief overview of suicide experiences across Florida, and then we'll spend the rest of the time talking about identifying suicide risk in others and yourself and what to do about it. So I'll talk about some things we can all do this holiday season to help both ourselves and others during this stressful time. So my name is Anna, and as Sky mentioned, I am the director of the Statewide Office for Suicide Prevention within Florida. I am located in Tallahassee, Florida, and with the Florida Department of Children and Families. So I really got started in the field of suicidology when I entered the clinical psychology PhD program at Florida State. My father retired from naval service after 20 years. He was actually stationed at the Pentagon on 9/11, 2001, and was among some of the first groups overseas in Operation Iraqi Freedom and Operation Enduring Freedom. So it was really through conversations with him and learning more about his experiences that I really started looking more into clinical psychology and clinical psychology for our military veterans. So that kind of process brought me to Dr. Thomas Joyner at Florida State and his work with suicide overall, and particularly with the Military Suicide Research Consortium. So my grad school career, as Sky mentioned, has really been focused on researching suicide-related thoughts and behaviors so that one day we can better understand factors that may cause and exacerbate these difficult experiences. And then, of course, improving and expanding the interventions that we have that can help alleviate suicide-related thoughts and behaviors. So that's kind of me in a research nutshell. Within a clinical capacity, I have worked with individuals who are at severe risk for suicide and over time have helped to decrease that risk. Right now, I've had the pleasure to combine the research world with the clinical world as that director of the Statewide Office for Suicide Prevention. So transitioning now into infrastructure within Florida, just a really, really brief overview of what it looks like. So the Statewide Office for Suicide Prevention, it's housed within the Office of Substance Abuse and Mental Health, and that's housed within the Florida Department of Children and Families. Our Florida suicide prevention infrastructure has really evolved this past year, so across 2020. So there's been an increased focus on prevention by our First Lady, Casey DeSantis, and the Florida Children and Youth Cabinet, which has really propelled us forward. Our Florida legislators actually created a first responders suicide deterrence task force, which helps us focus on suicide prevention among our firefighters and our police force. This year, we've created the Florida Suicide Prevention Interagency Action Plan, which is going to replace our previous 4-year strategic plan for suicide prevention and help us guide kind of activities for the next 3 years. This plan is a collaboration between many different organizations across the state and includes involvement of the managing entities, the substance abuse and mental health regional offices, and providers across the state, all working towards creating kind of their individual local plans as well. So this year, we've also created 4 committees within the Suicide Prevention Coordinating Council. This council is a legislatively mandated group of 31 agencies and organizations across the state. So they work, and the council works towards implementing suicide prevention efforts within their agencies themselves and then across kind of the state. So really my job is to help foster the collaboration, support prevention efforts across the state and across all of these different agencies. So I kind of pull everybody together. That's a really brief and quick overview of our suicide prevention infrastructure within Florida. And now I'd like to kind of transition a little bit and give us a better idea about why suicide is an important topic. So first, I'm going to give you some data about nationally what we're seeing with suicide, and then we'll talk about Florida more specifically. So in 2010, suicide was the 10th leading cause of death in the United States, with more than 48,000 deaths by suicide. It was also the 2nd leading cause of death for individuals 10 to 34 years of age, the 4th leading cause of death for our 35 to 54 age group, and the 8th leading cause of death for 55 to 64. Overall, firearms were the most common method used in suicide deaths, accounting for about half of all deaths. Importantly, too, we need to keep in mind that there are many other suicide-related experiences in addition to death, with national data suggesting that over 10 million Americans seriously thought about suicide, over 3 million made a plan for suicide, and over 1 million attempted suicide in 2018. Also looking at how many individuals are affected and exposed to suicide, with recent reports and research suggesting that 40 to 50% of the population will be exposed to suicide in some manner during their lifetime. So these are staggering numbers that we'd like to see decrease significantly. Importantly, too, when looking at our suicide trends over time, we've seen an increase over the past decade. And unfortunately, we are seeing similar trends within Florida specifically. So in 2019, 3,427 Floridians lost their lives to suicide, representing a 3.5 decrease from the number of deaths in 2018. So we did see in the individual numbers a slight decrease from 2018 to 2019. However, we still see a general increase of our suicide death rate across the previous decade. Also, suicide was the 8th leading cause of death overall for Floridians in 2019. For our specific age groups, it was the 2nd leading cause of death for our adults 25 to 34, and the 3rd leading cause of death for our adolescents and our young adults. Over half of suicide deaths in 2019 within Florida involved a firearm, similar to what we're seeing in the nation, and it accounted for over 1,800 deaths. So we can really see both nationally and within Florida that suicide is an extremely important topic affecting millions of people. I will say that as we're gearing up for the holiday season, typically we do see a slight decrease in our suicide experiences in December. Maybe this is an effect of the holiday season, but it's also important to recognize that for a lot of people, the holiday season is extremely stressful in many different ways, especially now with COVID-19, limited travel abilities, and the need for physical distancing. We're likely to see additional strain and experiences such as additional loneliness. It's more important than ever to really learn some of the warning signs of suicide and suicide-related thoughts so that we can help each other and our loved ones stay safe this holiday season. So while you're preparing for the holidays, I'd like to challenge you to learn some of these warning signs of suicide. So I'm going to go into each. There's three different categories of warning signs that we'll cover. I'll go into each, provide some examples, and then we'll talk about kind of what to do if you see some of these warning signs. So a common myth about suicide is that individuals who talk about suicide are doing so for attention. In reality, we see that many individuals who die or attempt suicide have actually given some clue or warning. So here are some of the themes individuals who may be experiencing suicidal ideation may express. So for example, you're sitting at the table for Thanksgiving meal, and your cousin mentions to you that he's struggling in school this year and is feeling trapped, and that he's a burden to his parents. Those statements would be a warning sign that your cousin may be experiencing hopelessness and is thinking about suicide. Explicitly talking about suicide or wanting to die is another warning sign that should always be taken seriously. Other themes that you may notice are talking about experiencing unbearable pain or having no reason to live. So again, I'll go into a little bit more detail about what to do if you notice some of these warning signs in yourself and your loved ones in just a moment. Another way that individuals may be showing signs of suicide-related thoughts and behaviors is through changes in their behaviors. So for example, you're finding it harder and harder to reach your friend and have your daily or weekly phone calls. She's either saying she's too busy or she's just not in the mood to talk right now. This could be a potential sign of social withdrawal. Some other behavior changes that may indicate an individual's experiencing thoughts of suicide is isolating themselves from others, changes in their sleep, suddenly acting more recklessly than they used to, or visiting or calling to say goodbye. It's important to note that for these, we're looking for changes in behaviors. So if someone is typically hard to get in touch with, that may not be a sign of social withdrawal. But if it's somebody that usually comes and reaches out and talks to you and they're suddenly withdrawing from you, that would be a warning sign. And our third category is mood. So when we're, again, looking for differences or changes in someone's mood. So for example, your brother really, really likes to play basketball, but he recently doesn't seem interested in shooting hoops with you, watching basketball, or really having anything to do with the sport. Instead, he's kind of spending most of his time in his room and in bed and just kind of seems sad and depressed most of the time. So those are signs that he may be experiencing depression, experiencing a loss of interest, and potentially thinking about suicide. Some other mood changes that you might see is an increase in irritability and sudden bouts of rage or anxiety. So maybe somebody's fuse is a little bit shorter than it usually is. Also, maybe something happened recently that has led to feelings of humiliation that just won't seem to go away. So these are all mood change indicators that may be suggesting some thoughts of suicide or suicide-related behavior. So now that we've talked about kind of each of those different categories of warning signs, let's talk about more what to do if you see some of these signs. Another common myth of suicide is that asking someone if they are feeling suicidal or thinking about suicide will give them the idea. This fear, however, has not been supported by research. And indeed, research actually suggests that talking about suicide may provide therapeutic benefits and is helpful for someone struggling with thoughts of suicide. So I'd like to say that again, as it's very important. Talking about suicide will not give someone the idea. and is actually one of the most helpful things that you can do. So if you see any of these warning signs, and especially if you see a few of them together, the first step is to have a conversation. Don't be afraid to ask directly if they have been having any thoughts of suicide. So some example of wording that you can use is, have you had thoughts of suicide? Or do you ever feel so bad that you think about suicide? Or do you have a plan to kill yourself? Asking directly and using specific words to help you best understand will help you best understand what someone might be feeling and thinking. So always asking directly. Now that you've asked directly and someone says that they have been wanting to die or have thoughts of suicide, what do you do now? Well, the first thing to do is to stay calm and to respond with kindness and care. So do your best to listen without judgment and provide support for that individual. Listen in your conversation for maybe some specific reasons to live or reasons against death. So things like a support system that matters a lot to that person, or maybe some of their plans for the future, and see if you can talk a little bit more about those things. It is best not to argue or challenge the person, and definitely don't dismiss or minimize their problems. So while it may seem helpful to say things like, it doesn't seem that bad, or suicide is a permanent solution to a temporary problem, these statements can be hurtful to the individual. Instead, try saying things like, I'm here to listen and support you. And it sounds like you're going through a lot right now. I want you to know that I care about you. This is just a small piece of the things that you can do if you think someone you love might be thinking about suicide or is struggling this holiday season. So please don't be afraid to have conversations with your loved ones and to ask them directly how they're feeling and how they're doing. Ultimately, it's really important to highlight and know that help and resources are available. Florida Crisis Mobile Response Teams provide on-demand intervention services for behavioral health crises. They can assist in the evaluation and assessment. They can also help develop a safety or crisis plan, provide or facilitate stabilization services, provide supportive crisis counseling, education, development of coping skills, and they can also help you refer to the appropriate resources. So the MRTs are really designed to target kind of our youth and our adolescents and individuals under the age of 25. However, many teams will also provide services for adults as well. So on the screen, you'll see a link to find your local mobile response team within Florida. Of course, if you believe that you or a loved one is in immediate danger, please call 911 or the National Lifeline at 1-800-273-8255. The Lifeline is available 24/7 in times, even if it's not an immediate crisis, but they can also help you if you are concerned for a loved one or concerned for yourself. There's somebody to talk to there 24/7. If you're interested in learning more and to access additional resources throughout Florida and also nationally, Florida, we do have a suicide prevention website. That's a really good place to start. So we've linked that on the screen as well. Also on that website, there's a calendar on the front page that includes local and national suicide prevention related events. So definitely check that out if you're interested in learning more and getting more involved in suicide prevention. Additionally, kind of two more resources that I utilize just about daily is the Suicide Prevention Resource Center, or SPRC. Just put the link on the screen right now. And then the Florida Suicide Prevention Coalition. These are both great places to find local and national resources and more information about the warning signs of suicide, what to do if somebody you love is feeling suicidal, and more suggestions on how to react and some of those strategies. All right, so now that we've learned some of the warning signs for suicide and what to do if someone we know is experiencing thoughts of wanting to be dead or of suicide, let's talk a little bit more about strategies to help with holiday season stress. So, more specifically, establishing and maintaining a routine and structure can really go a long way in helping combat your mental health difficulties. So this routine could include a regular sleep schedule, regular eating schedule, anything that you can do to kind of stay as normal as possible, even when holiday travel or holiday time off may be changing your schedule. Having that set routine can provide your body and your mind with kind of feelings of control and can help you continue to engage with activities or things that you need to do. Other strategies include doing something fun or enjoyable each day. So these should not be tied to rewards for doing other things, but rather is an activity that you do no matter what happens throughout the day. So for example, I really like to play soccer. So I try and get outside and get a few touches on the ball almost every day if I can. Other examples could be things like reading, writing, painting, playing an instrument, playing with your cat or dog, knitting, really anything that you enjoy doing. And again, this shouldn't be contingent on what you had done that day. Especially during these trying times, it is even more important to kind of maintain our social connectedness however possible. So please be mindful of safety, of course, and engage in connection through physically distanced and healthy ways. But any way that you can kind of maintain your social connections will go a really long way for helping your mental health in these trying times. You can also engage in mindfulness activities. So activities such as deep breathing have really been shown to decrease your blood pressure. And of course, moving your body. So getting up, taking a walk, even if it's just for a couple of minutes. Getting your body regular exercise can really improve both your physical and your mental health. So those are kind of some strategies for yourself that you can engage in, but I also wanted to include some strategies to keep in mind when you're interacting with other people and your loved ones during these holiday seasons. If you hear that somebody is struggling a little bit with their mental health, these may be some ways that you can kind of help support them. So for example, maintaining regular contact with them, right? Checking in on them regularly, seeing how they're doing, seeing if there's anything that you can do to help them. Encouraging the self-coping strategies, that's, the ones that are kind of on the for yourself side, encouraging and sharing those with them as well. Encouraging them to engage in other activities, or if they are involved in activities that they want to start engaging in, but just need that little extra push, right? Maybe you can do that for them. And then of course, using your listening and your empathy with your friends and family as well, understanding that we're all a little bit stressed during this time, and especially with COVID. So giving them a little bit extra leeway. I'd also like to challenge each of you to share some of the resources that we discussed today, maybe some of those linked resources that we had earlier, and some of these coping strategies with everybody as well. And of course, always remember that it's okay to not be okay. Even during the holiday season when everybody seems really cheery, it's okay if you're not. And also that help is available. So reach out to other people, reach out to your loved ones, and let's kind of keep each other safe this holiday season. I'll also say that this is my contact information as well. So if you have any questions about anything that I talked about today, do feel free to reach out to me directly via email or via phone as well. Sky, I think you're still muted.
Yep, there we go. Thank you. That was a lot of great information. One of the questions that came in was, do you have tips for people that might be worried about a loved one but aren't sure how to be there for them during social distancing?
Yeah, so I think especially in today's world, technology is really helpful for this. So checking in, sending a text even every once in a while, or a good morning text, even just a small little gesture like that can really go a long way in helping out your loved ones. Other ideas could include, if you're in the same area, doing a drive-by or scheduling a drive-by where you might be able to kind of slow down, wave at them, or have some kind of outdoor, physically distanced conversation. Any way that you can kind of utilize some of the technology that you might have, and or those kind of physically distanced, pop-up times might be helpful as well.
Thank you.
Mhm.
So what are some ways I can keep myself and my family safe from the risk of suicide?
I think that's a really great question. So one of the another common myth with suicide is that the risk of suicide is going to be kind of a forever thing, when in reality it's more like our typical emotion wave. So you may have kind of a baseline where maybe you're thinking about suicide all the time, but then you'll have a moment of a more intense feeling or a more intense urge. But eventually that does go away. So that may last a couple minutes up to a couple hours. Knowing that kind of that wave will go away eventually. So to keep yourself safe, having some kind of plan in place when you do experience that more increased emotion, that more increased urge, can be helpful. We call those safety plans. So it's kind of just having a list of coping strategies that you will engage in to kind of increase the time between having that urge and acting on that urge. So having a safety plan in place is one way that you can do that. For families that have children, or even families that have firearms within the household, engaging in safe storage practices before a suicidal crisis can really go a long way in keeping yourself and your family safe. So that could be storing the gun with a gun lock, maybe keeping the ammo in a separate place and storing it unloaded. Anything that you can kind of do to increase that physical distance and increase that time from that urge to whenever we're acting. Same thing with medications as well. So if we have a lot of medications in the house, using a medication safe or keeping it away from where children or adolescents may be able to access them are also things that we can do prior to a crisis that can really help.
Great. A question that came in was, do you have any tips or advice on maintaining healthy boundaries with a loved one struggling with the thoughts of suicide? So how can you support them without depleting yourself?
Mm-hmm. I think that's a really great question because a lot of times, we do see some of that burnout or that compassion fatigue is what that's usually called within like our clinical setting, but it also happens with loved ones as well. So it's really important to engage in your own self-care. So anything that you can have to help you recharge that is enjoyable for you and setting that boundary. Another thing is sharing some of these resources and encouraging your loved one to reach out themselves to some of these lifelines. So reaching out to the lifeline, if they're not comfortable, maybe doing it together where you're with them on the line, but they're taking charge of that phone call. So any way that you can kind of help guide that loved one to seek those services can also go a long way. There are also other organizations that can provide support for individuals with lived experiences. So the American Association of Suicidology includes a really, really large population of individuals that have lived experiences. So reaching out to communities like that who may be going through similar experiences may also provide you some additional support resources and additional outlets as well. A really great question.
Our next question was, has there been an increase in the suicide rate due to COVID-19?
This is a very good question. So recently in August, the CDC did release a report that suggested there has been an increase in suicide-related thoughts from this time in 2019. Importantly, though, there's no evidence to suggest right now that our death rate has increased. So we may be experiencing some of those thoughts a little bit more, but in terms of our death rates, we haven't seen any impact yet. That could be our data is not up to date yet, or it could be that we'll see a long-term effect. So any way that we can kind of engage in some of these strategies to help mitigate any of the effects that we might see from COVID-19 will be helpful in the long run.
And our last question right now is, there's been an increase in the suicide rate among children and teens. What do you think this is causing this, and could social media be affecting this?
So that's also been a pretty relevant question that I've gotten a couple times. So we have seen an increase in our teen and adolescent suicide, or teen and children suicide, excuse me. And there is a correlation. So there is a relationship with increased social media use as well. What some of our research is suggesting, though, is that it may not necessarily be social media itself, but what social media is replacing. So instead of spending time with friends or spending time with loved ones, we may be spending more time on social media. Or instead of getting outside and exercising and sleeping, social media has really changed the way that our youth are sleeping today, and that really has an effect on our mental health. So it could be that's where the relationship is through. It could be that social media itself is causing it. It's most likely a combination of all of the above.
And we had another question come in. What can adults in the community do to support our students more in these efforts and prevent suicide among our youth?
So I think a part of that is having that open conversation, right? So not being afraid to ask directly about some of these experiences and how your kids are doing. So reaching out to them. Also with kind of school support, right? School right now is extremely stressful. The Suicide Prevention Resource Center has some great resources in terms of addressing suicide risk with COVID-19 with schools. And so there's a bunch of resources out there to kind of give you toolkits and guidelines on how to prevent decrease risk among our school age kids. But I would say, really having conversations with your kids and engaging in those means safety practices as well. So that medication lockup, if you have a firearm in the house, storing it safely so that your youth doesn't have access to it. Things like that can be helpful in these times.
We had a question come. What is the best first step someone can take if they are experiencing suicidal thoughts?
Reaching out, I think, would be the best first step. So that could be a trusted loved one or a friend. Reaching out to the National Lifeline, 1-800-273-TALK. Reaching out and kind of talking to other people about it, and looking for those resources. Getting involved. The social connection can really go a long way.
And I think that is the end of our questions that we have coming in. Thank you so much, Anna, for taking the time to talk to us and share all this great information with our community.
Of course. And of course, if you guys can all take the time to take the pledge to check in at thecheckinproject.org. And of course, if there's any of the resources that we can provide you from today's talk, just let me know as well.
Thank you.